business. Notice number 6, rural maternity services.
I call the member for Wide Bay.
Speaker, I move the motion relating to rural maternity services in the terms in which it appears on the notice paper. Welcoming a baby into the world should be a joyous time for parents. But if you're one of the 7 million Australians living in rural and regional areas, chances are you're a long way from maternity services and have every chance of birth in the gravel on the side of the road. Since the early 1990s, the number of babies born before arrival has increased by 50% nationally and doubled in Queensland, alarmingly. Over half of rural maternity services, or more than 130, including in Maryborough and Wide Bay, have closed during the same period. These closures disproportionately impact smaller services, putting much longer distances between maternity services. Despite the bigger means better safety mantra, smaller, much-needed rural maternity services, where they are available, have been proven to be as safe as large facilities in metropolitan areas. There is little evidence that maternity service closures are entirely a result of these workforce shortages also, but once they close, it's more difficult and rare for them to reopen. The closure of rural maternity units puts greater financial burden and psychological stress onto families. These families are hit by higher travel and accommodation costs. They are forced to leave their local support systems, their employment and school for other children at a critical time. According to the Australian Institute of Health and Welfare, rural babies are more likely to be premature, facing lifelong health challenges. But the most tragic consequence is the one we can't ignore. More rural and remote mothers and babies don't come home at all. Our nation's rural families are the lifeblood of our country and our economy. However, despite contributing so much to our economy, there's little in return for them in the way of healthcare and maternity services. A recent report by Nous Group's Health and Ageing Practice found that there was a $6.55 billion shortfall between healthcare funding for rural and urban Australians. Disappearing local maternity care exacerbates the rural-urban health gap. Rural Australians begin experiencing health disadvantage before they're even born. Despite shrinking maternity services, endorsed midwife numbers have increased across rural and regional Australia and continue to fill in gaps for rural families by providing much-needed antenatal, birth and postpartum care, often travelling long distances to deliver these services, but there are outstanding structural barriers that must be urgently addressed by government to help more rural families. The federal government provides significant funding to all our states and territories for hospital services, including maternity services. This funding needs to go to rural towns to ensure we have the services that these families rightly deserve. The Australian Rural Birth Index is a tool created to ensure adequate services are available to expectant mothers in these regions. It's up to the Albanese Labor government to hold states and territory governments to account by tying funding to the Rural Birth Index to improve outcomes in regional areas and not let their Labor mates in Queensland off the hook as they slash rural maternity services.